You know, in over 12 years of practicing medicine, one question comes up more than almost any other. Patients sit down across from me, and somewhere in the conversation they ask, "Dr. Foster, what's the one thing I should actually be doing for my health right now?" Not another prescription, not a complicated regimen, just one thing they can actually stick with. And my answer, every single time, is walking. Every day. I see the look on their faces, a little surprised, maybe a little underwhelmed, because walking feels too familiar, too ordinary to be a real medical recommendation. I get it. But here's what I've come to understand after years of working with patients in their 60s, 70s, and beyond. Most people have never been told what walking actually does inside the body. Not just, it's good for your heart, the real mechanism. The biological chain of events that begins the moment you head out the door and builds with every single day you show up. That's what I want to share with you today, because in my experience, when patients understand why something works, they follow through. So let's talk about what's really happening inside your body when you walk consistently, and why, at this stage of life, it may be the most powerful thing you can do. Number 1, your muscles start acting as a second metabolic system. Most of my patients are genuinely surprised by this one. We think of our muscles as tools for getting around, but research shows something remarkable. When you walk, your skeletal muscles begin drawing glucose, that's blood sugar, directly out of your bloodstream, without needing insulin to do it. There's a protein called GLUT4, GLUT4, that gets activated during movement and opens a direct channel into the muscle cell. For my patients who are managing blood sugar, and at this age that's a lot of us, this is significant. A study following people with elevated blood sugar found that just 15 minutes of walking after a meal reduced the post-meal spike by about a third. That's not a medication doing that. That's your own body responding to movement. Number 2, your brain produces something it can't make any other way. I bring this up with nearly every patient I see over 60 because I think it's that important. There's a protein called BDNF, brain-derived neurotrophic factor. The simplest way I can describe it is this. It's fertilizer for your brain cells. It strengthens connections between neurons and actually supports the growth of new ones, particularly in the area of the brain responsible for memory. Researchers at the University of British Columbia found that people who walked regularly over 6 months had a measurably larger hippocampus, that's the memory center of the brain, than those who didn't. For my patients who worry about staying sharp as they get older, that finding matters. Your brain is not simply declining on a fixed schedule. It is still responding to the signals you give it. Number 3, your heart and blood vessels begin to remodel themselves. This one I especially want my patients managing blood pressure to hear. Every time you walk, your heart works a little harder and your blood vessels respond. The cells lining the inside of your arteries, called endothelial cells, release a compound called nitric oxide. Nitric oxide tells the artery walls to relax and open up. Over time, with consistent movement, your arteries actually become more flexible. A study that followed participants for a full year showed that people walking 30 minutes a day, 5 days a week, had measurably lower arterial stiffness than those who were sedentary. In clinical practice, arterial stiffness is one of the main contributors to high blood pressure as we age. Walking isn't just good for your heart. It changes the vessels your heart depends on. Number 4, inflammation starts to come down throughout your entire body. Chronic low-grade inflammation is something I talk about in almost every appointment because it quietly underlies so many of the conditions we manage at this stage of life: joint pain, cardiovascular disease, metabolic issues, even cognitive changes. And here's what's encouraging. Consistent walking is one of the most effective tools I have for reducing it. The mechanism is real. Regular moderate exercise lowers baseline levels of inflammatory markers in the blood over time. The body is learning to stay regulated because it keeps receiving the signal that movement is part of life. Number 5. Your joints actually feel better with movement, not worse. This is the one I have to work hardest to get my patients to believe. I hear it all the time. Dr. Foster, my knees hurt. I can't walk. And I understand the concern. But here's what most people don't know. The cartilage in your joints, the cushioning that absorbs impact, has no direct blood supply. It gets its nutrition from synovial fluid. That's the natural lubricant inside your joints. And that fluid only circulates when you move. Sitting for long stretches actually starves your cartilage of the nutrients it needs. Walking pumps synovial fluid through the joint space. It's one of the reasons so many of my patients find that gentle, consistent walking actually reduces their joint discomfort over a few weeks, not increases it. The movement is the medicine. And if you're finding this helpful, go ahead and hit that like button. It genuinely helps more people in our age group find this kind of information. Now let's keep going. Number 6, your mood and emotional resilience improve in a measurable way. I want to be straightforward about this one because I think it gets dismissed too easily. Walking increases serotonin and endorphins. Most people know that. But what's less understood is that consistent walking appears to gradually change how sensitive your brain is to its own mood-regulating chemistry. It's not just a temporary lift, it's a slow recalibration. A study published in JAMA Internal Medicine found that people who walked briskly for around 35 minutes a day had significantly lower rates of major depression, with effects comparable to low-dose antidepressant therapy in mild to moderate cases. As a physician, I think that deserves to be said plainly. This isn't about feeling better, this is biology. Number 7. Your body becomes more efficient at using stored fat for energy. At a comfortable walking pace, I always describe it as a pace where you can still hold a conversation. Your body runs primarily on fat as its fuel source, not sugar. That's meaningful. Here's a simple way to look at it. 30 minutes a day, 5 days a week. Over a month, that's roughly 10 hours of your body preferentially burning stored fat. But what I want my patients to understand is that it's not really about the calorie number. You are training a metabolic preference. The more consistently you walk, the more your body learns to access fat efficiently, not just during the walk, but increasingly throughout the day. Number 8, your sleep quality improves significantly. I review sleep patterns with my patients regularly, and the connection to daily movement is consistent. People who walk regularly fall asleep faster, spend more time in deep sleep, and wake up less during the night. Part of this is straightforward. The body has physically worked and is ready to recover. But the other part involves cortisol. That's your primary stress hormone. Walking helps normalize the cortisol curve across the day. Lower in the evening when you need to wind down, more appropriately elevated in the morning when you need to be alert. For a lot of my patients who lie awake despite being exhausted, that dysregulated cortisol pattern is exactly what's getting in the way. Consistent movement helps restore it. Now, I want to be direct with you, the way I am with my patients. I've seen people try walking for a week, feel about the same, and give up. And I understand that. But here is the clinical timeline the research actually supports. In the first 7 days, your blood sugar response after meals is already improving. By 30 days, your cardiovascular system has begun structural adaptation. Arteries more responsive, resting heart rate trending down. At 90 days, we see consistent changes in mood, cognitive performance, and inflammatory markers across multiple studies. These aren't dramatic overnight results. They are steady, compounding changes that reflect your body doing exactly what it's designed to do, when given the right signal. And here is the most important thing I can tell you. Intensity is not the variable that matters most at this stage of life. Consistency is. Walk occasionally, and your body treats it as the background noise. Walk every day, and your body starts building around it. It treats it as instructions. That is what biological adaptation is. Your body becoming what it keeps being asked to be. I know some of you are thinking, if this is so effective, why don't I feel it yet? In my practice, the answer is almost always one of two things: inconsistency, or walking below the threshold where adaptation begins. The research points clearly to 20 to 30 minutes, at a pace that gently elevates your breathing. Below that, you're maintaining. You're not yet signaling. So here is what I'd like you to do. Commit to 20 to 30 minutes of walking every single day for the next 30 days. Not when it's convenient. Every day. Because your body is always responding to the signal it receives most often, and 30 days is exactly long enough to feel a real shift. I'd love to hear from you in the comments. What's the biggest barrier that gets in your way? I read every response, and I genuinely want to understand what's making this hard. And if you'd like to understand what happens when you pair daily walking with one other simple daily habit, I put together a video on exactly that. The two together compound in ways that genuinely surprised me when I reviewed the research. That one is right here, and I think you'll find it worth your time. I'm Dr. Megan Foster, and this channel is where we talk about what the science actually says, in plain language that's useful in real life. If you haven't subscribed yet, I'd love to have you here for the next one.